Welcome to the module Health Insurance and Transition. This is the 7th of 10 modules in this course. Eligibility and application requirements change frequently. Always direct the patient and the family to the insurer for updated information. By the end of this module, you will be able to describe common options for health insurance coverage for transition-age patients, refer patients and families to insurance resources, and add insurance-related activities to transition plans. Addressing insurance options during transition is critical for care continuity. Prior to the Affordable Care Act, transition included financially or medically catastrophic gaps in health care. Consider the immediate and the long-term effects of losing prescription coverage for patients with cystic fibrosis, diabetes, or muscular dystrophy. How many days or months without treatment are acceptable? Today, if patients plan ahead, losing coverage is avoidable. This section describes Medicaid, highlighting differences between coverage for children and for adults. KidCare is the state of Florida's health insurance program for children ages 0 to 18. Florida Healthy Kids, Medicaid, and Children's Medical Services Network are all part of KidCare. These related programs have specific eligibility requirements for their services. KidCare benefits include well child visits, vaccinations, hospital stays, dental coverage, vision services, prescriptions, and mental health services. Additional benefits vary by program. Patients age out of coverage at their 19th or 21st birthday depending on which program provides the patient's KidCare coverage. The patient must then apply for new coverage, whether through Medicaid or through other insurers. Patients moving from KidCare to Medicaid will find many differences between the two programs. For example, early and periodic screening, diagnostic and treatment, or EPSDT, mandated benefits end at age 21. Conversely, patients who did not meet financial eligibility for KidCare may qualify for Medicaid. Typically, adults are eligible for Medicaid if they are permanently disabled, ineligible for Medicare, and meet financial requirements. There are several specific programs under which adults may qualify for Medicaid beyond these parameters. The next few slides will examine some of these programs. Adults who are eligible for SSI are automatically eligible for Medicaid coverage. The Social Security Administration manages this coverage. The patient need not file a separate Medicaid application unless they require waiver services from the state, such as for nursing home services. Patients who age out of foster care under responsibility of the state of Florida and with Medicaid may continue their coverage until age 26. There is no income limit or medical requirements for this coverage. Home and Community-Based Service, or HCBS waivers, are Medicaid programs that provide services in the home for persons who would otherwise require institutional care in a hospital or nursing facility. Without waiver services being delivered in the community, some young adults might not be able to live at home or receive needed supports in the workplace. Waivers provide specific services over and above those in the general Medicaid adult benefits package and are targeted to persons who demonstrate the need for a high level of care. Enrollment is typically capped. Once enrollment reaches a specified number of patients, waiting lists are created. The Agency for Persons with Disabilities Waiver provides home and community-based services for people with specific intellectual or developmental disabilities. Each individual who is determined eligible for services is assigned a support coordinator. Once on the waiver, their support coordinator meets with the patient regularly to assess, develop, and monitor an individualized support plan. The support plan, much like a transition plan, includes goals for patient services, health, and safety. Much like the other waivers, it is extremely important to apply despite the wait list. Those on the wait list receive limited services until they enter the waiver program. If a patient begins receiving services in childhood, including their APD support coordinator is an excellent resource for creating and implementing the healthcare transition plan. Young adults have multiple options to maintain coverage through their parents' insurance. Adult children can rejoin or remain on a parent's plan until age 26, even if they are otherwise independent. This rule applies to parents' employment benefits and to individual plans, such as those purchased on healthcare.gov. 44 states, including Florida, have laws that mandate that insurers continue coverage of children with disabilities after age 26. To qualify for continuation of coverage, a physician must certify that the patient is incapable of self-sustaining employment due to intellectual or physical disability. The patient must also be chiefly dependent on the policyholder for support and maintenance. Examples of patients who may be eligible include those who receive SSI or SSDI benefits, those who require total supervision, physical assistance, or custodial care, or patients for whom treatment, rehabilitation, educational training, or occupational accommodation has not resulted in an ability to support themselves. The marketplace plans are those created through the Affordable Care Act. Adults use the marketplace to purchase individual coverage. Patients can sign up for health insurance during open enrollment periods, at the end of the year, or upon major life changes such as marriage or a change in income. The state of Florida elected not to create a state-based marketplace. Therefore, healthcare.gov is the only source of marketplace plans for Floridians. The next few slides describe additional options to obtain healthcare coverage. Patients may elect to use their own employment-based insurance prior to age 26. In the event that the patient loses access to their own employment-based coverage or to their parents, they may elect to extend those benefits by purchasing COBRA, continuation of health insurance. Patients with chronic conditions may be eligible for other public insurance programs, including Medicare. Even if a patient does not qualify for Medicaid, they may qualify for other state programs, such as medically needy coverage or discount drug programs. List 3 places you will refer patients and caregivers to when they have insurance questions. These might include a specific person in your practice or hospital system, a specific program, or a website. This slide will automatically advance in 1 minute, giving you time to jot down your answers to the questions on this screen. Insurance is a dense and potentially overwhelming topic. This section identifies ways to include insurance in transition plans. Patients and parents and caregivers have varying levels of familiarity with healthcare rules and requirements. Educate patients about the importance of maintaining coverage and guide them to reliable resources. Inform patients with disabilities of key provisions within the ACA that protect their coverage. Just the Facts, the 411 on health insurance for young adults ages 18 to 30 in Florida, helps patients navigate health insurance. It has sections for different insurance needs, such as private health insurance, public health insurance, and no health insurance. Provide the guide to patients as a transition plan activity. Consider age-appropriate steps for health insurance at each stage of transition. Examples of such activities include carrying their own insurance card, reading an explanation of benefits summary, reviewing the current health insurance plan, locating key information about new coverage, and identifying important dates. Healthcare.gov provides a website for patients to find local assistance with signing up for health insurance. The site is searchable by state or by zip code. Add contact navigators to the transition plan to coincide with the patient's age out of pediatric coverage. Encourage parents to contact their employer or insurance company to continue dependent coverage throughout the transition stages. This is especially important for patients age 25 or 26. Patients can complete the adult Medicaid application online or by mailing in a paper application. Use transition assessment and planning tools to include filing a Medicaid application at age 19 or 21. The waiting lists for Florida Medicaid waivers can be quite long, sometimes years. Don't discourage the patient from applying because of the waiting lists. This is the only way to access waiver programs. To apply for a waiver, the patient should contact the operating agency and/or submit a Medicaid application. This is an extremely important transition plan activity for patients who will require in-home care or nursing home care. Before closing this module, let's look at tools to support these strategies in your practice. Within the Medicaid website, this page provides contact information for local and regional offices. This site provides the newest and most relevant articles on the Affordable Care Act for young adults. The Florida Division of Consumer Services has a website dedicated to state protections and programs for purchasing health insurance. The Exceptional Parent website offers a succinct summary of how the Affordable Care Act affects patients with developmental and intellectual disabilities. These are additional resources for obtaining public coverage. Transitioning youth have more options than ever for maintaining coverage. Finding out specific information for their individualized coverage needs is a dense but important topic. Encourage patients and families to be persistent with insurers. Use the links from this course's toolkit to access the resources from this module. Much like your patients, your colleagues in adult medicine also need transition preparation. You can pause the presentation for a quick break or continue on directly to the next module.